has joined this week Health Technical webinar. This webinar is 10th in the series, and in the next 1 hour, we are going to focus on COVID-19 and first aid programs. So let's run through the agenda, like what we have for us in the next 1 hour. We will start with our customary situation analysis, trying to know how the virus is behaving in Asia Pacific. Then it will be followed by a quick demo of the dashboard by Nick Prince, our pandemic preparedness coordinator in the Asia Pacific. Then we will have a session on COVID-19 and first aid, how we can still continue providing first aid services on the face of COVID-19, different tools that are available, and what are the things in making. It will be presented by our colleague from Global First Aid Reference Center. Then we'll have an experience sharing session from the Hong Kong Red Cross branch by Barbara. She will be talking about the blended learning methodology, which might be the order of day in the face of COVID-19. Then we'll have around 10 to 15 minutes for question and answers. If you have any question around first aid or around how the virus is doing in the region and around several aspects of the dashboards, etc., we will be happy to answer those questions. And then finally, we'll have a closing remark and key messages from John Fleming, Head of Health, Asia Pacific. So let's go to the overall situation of COVID-19 in the Asia Pacific region. So we have more than 845,000 confirmed cases with more than 23,000 deaths in Asia Pacific. There are 3 countries like Philippines, Indonesia, and Bangladesh who have been labeled as having community level transmission. We have a bit diverse picture in Asia Pacific as far as COVID-19 is concerned. We have on one hand India, Pakistan, Bangladesh, and Indonesia, which are constantly showing the rise in COVID-19 cases and primarily are driving the pandemic in the Asia Pacific. However, we also have countries in Asia Pacific like New Zealand, like PNG, Laos, etc., which have 0 active cases of COVID-19. So that do definitely present a very diverse picture of COVID-19 in the region. On top of that, like there is a major concern around the testing capacity of several countries. Countries like Myanmar and Indonesia do represent very low in terms of testing and may not have represent the actual COVID cases in their countries because of lack of testing capacity. We are also a bit worried about now as the cases of COVID-19 are increasing in countries with weaker health system. And as per the Informed Risk Index, these countries might have severe health and humanitarian impact because of COVID-19. Those countries are Afghanistan, Pakistan, Nepal, etc. These countries might have serious health and humanitarian impact because of COVID-19. Some of the countries in the Asia Pacific do have decided to coexist with the virus as they are easing the lockdown without already fulfilling the 6 criteria determined by WHO around the easing of the lockdowns. Hence, there can be in coming days, we can see a steep rise of cases of COVID-19 in these countries. There is also a huge impact of COVID-19, or we can say the secondary health impact. That is, we have seen the increase in maternal mortality rate in the Asia Pacific region. The vaccination percentage had got down, and also the infant mortality rate has increased. There is also a prediction there will be a surge in increase of tuberculosis cases in days to come because of COVID-19. And as you all know, like China for some time have no local transmission, but like in past 2 days, there has been a cluster of cases that has been identified in in China. Now the Chinese government is also bracing for the second wave. Is it the beginning of the second wave? And they are really worried around those things. So this is just a snapshot how COVID-19 is evolving in the Asia Pacific. And as you know, these are our three important website: Health Help Desk, IFRC Go platform, and Asia Pacific dashboard. And after this presentation, Nick will take us through the Asia Pacific dashboard. Nick, over to you. Thank you.
Thank you. Can I just get confirmation that the dashboard is up on the screen? Over.
Yes, Nick, go on.
Okay, so I'm going to give you a short presentation just to introduce everyone to some of the features on the AP COVID-19 dashboard. I have put a link in the chat box, so if some of you can multitask, you can open the link, and as we go through the presentation, have a bit of a play on some of the stats. You're not going to do any harm to the dashboard, but encourage you to really start familiarizing yourself using some of the features on the dashboard. So it's been developed by our information management team based in APRO, and the purpose of the dashboard is to provide a visual snapshot on daily crude or raw data on COVID-19 cases and deaths at a country, regional and global level. The objective of the dashboard is to allow you as the user, anybody in any of the national societies and CSSTs, country offices, to look at the data specific to the countries in their region. And then we can do some further analysis because it is just raw data. Now the data source, this is not IFRC owned data. It is extracted from reliable sources, and we're currently using the Johns Hopkins University Global Dashboard, and I do have a link for that at the end of the presentation. It's important that we do cross-check and triangulate, so you'll find that the JHU matches the WHO dashboard. And this is the reference that most of you will use in your domestic response plans. Now, the new features on the dashboard, it now has 2 pages, and it'll include the case fatality ratio, the growth rate, and testing. So we're just going to navigate through some of the features, and we're going to start over on the left, and you'll see on the top left-hand side, and we'll go in a clockwise rotation, that the confirmed cases, this is the total number of cases that Dr. Abhishek was mentioning. It has gone up slightly. These stats are from yesterday. You've got the total number of deaths in the region, and then you've got the total number of active cases on the top right-hand side. Coming down on the right-hand side, you'll see that you've got the number of countries affected. So we have 38 countries with national societies in the region. 27 of those have reported at least 1 case. And then we come down on the right, you'll see the number of community transmissions, and we have 3 countries with community transmission. Then if you go into the middle and to the right, you'll see that there's a map, confirmed cases represented by a map and a table. If you hover with your mouse on any of the countries on the map, there'll be a pop-up table that will provide you with the number of confirmed cases for that specific country, the number of deaths, the number of recoveries, active cases, and the transmission mode, whether it's a cluster, community, or sporadic outbreak. You'll also see at the bottom of the map, there are 3 tabs saying confirmed, active, and transmission. Now this map is representative of confirmed cases. If we want to look at active cases, we click the middle tab and you'll see that the map changes in color to sort of yellow to browns. This is the active cases, the total number in each country and at the region. It's represented by a map, and again the table on the right will change. It will shift to active cases and deaths. If you hover again on any country, you'll get a little pop-up table which will give you the number of active cases, confirmed cases, deaths and recoveries, and so on. If you click the transmission box, this will give you a breakdown on the mode of transmission. So there are 3 transmission modes that we're looking at. The yellow bar is the sporadic cases where there's been 1 or more cases imported or locally detected. You'll see the orange, which is the cluster outbreaks. This is what's most common, are outbreaks. So that's within a setting. It's a controlled environment. It's either at a workplace, a residence, a school, hospital, nursing home, or a local isolated community. Community transmission is the one that we look at, is where we've got currently 3 WHO-defined community transmissions, and that's in the Philippines, Indonesia, and Bangladesh. Again, if you want to look in your specific region or country, you can just hover over one of the countries, and that'll give you a breakdown on how many cases, the type of transmission, the definition of that transmission type, cases, deaths, recoveries, and active cases. Now, if we come down on the main page, on the first page to the right-hand side, we've got the global figures. So the number of countries that have reported a case. So there's been 187 countries. As you can see that we've got close to 8 million, it has reached 8 million, over 8 million this morning. And what's significant for us is that it's going to be taking less than 1 week for 1 million new cases compared to last week. So we're really watching the rate of growth on number of cases. It's got the total number of active cases, which is the number of cases less the number of deaths, and those are recovered, and the total deaths globally. Useful for a global comparison, so we can look at the Asia Pacific. We have 60% of the world population, but we're representing approximately 10% of the global stats for cases. If we come at the bottom in the middle, you'll see what we call the epicurve. So this will give you a really quick visual snapshot of the trajectory on how cases are increasing, confirmed cases, active cases, and total deaths. If we look firstly at the Asia Pacific region, you'll see the red line. It's the increase there is quite a steep incline of confirmed cases. And then if you look at the active cases, that's falling down a little bit. As we can see towards the end of May, beginning of June. If we cross to the other side, we see the deaths. There was a sort of a kink there in early May, but we're really seeing a significant steep rise in the number of deaths in the Asia Pacific region. We can click on a specific country from the table on the right, and I'm giving Australia here as an example. We can see with the red line on the graph on the bottom left-hand side, confirmed cases were steep up to the end of March, beginning of April. That has really tapered off, and what we call that flattening of that curve. If you look at the active cases, which is the brown line on the left-hand side, there was a rise in active cases, wasn't much different to the number of confirmed cases, but throughout May that has significantly dropped. So Australia is now having very few active cases, and we'll see countries like New Zealand, Laos, Fiji, Timor-Leste, and PNG. You'll see that they have 0 number of active cases. On the right-hand side, you see the total of deaths for Australia. There was a rapid increase during April, and that has really flattened off recently. And then we come on to the case fatality ratio, a new feature and a very useful feature for us. So the case fatality ratio, or CFR, is the proportion of deaths from a certain disease compared to the total number of people diagnosed with the disease over a certain period of time. Now, we need to note here that this pandemic is ongoing and there are still cases, so we won't have an accurate CFR until the pandemic is over. The CFR ratio will likely increase at the end of the outbreak, and that is because there will be secondary related deaths. So whilst there might not be any active cases, there will be those who are hospitalized, and maybe because of the impact of COVID on how it might affect other parts of the body, other diseases, we might see that COVID will have influenced an earlier death in many cases. Now, this is the second page of the dashboard, and what we're looking at here is the growth rate. So the growth rate gives us an idea how is the rate of growth in the region and in each country. For every infection, there must be at least one more infection for the disease to grow. So we're looking at one person who's infected may infect 3 other persons. If that occurs, that increase is that there is an increase of that disease. A figure consistently above 1.0 This means that the disease rate of growth is increasing. If it's consistent below 1, it means the disease growth is reducing. Now, we work this out by basing today's number of new cases to the previous day. But what is preferable is looking at the last 7 days and comparing that to the previous 7 days. So we're dividing today's new cases, or the week's total, by the previous day's cases, or the previous day's 7 days total. However, a big however here. Growth rates taken on a daily basis are subject to the volatile nature of cluster outbreaks, and countries with large populations may have a growth rate less than 1, but significant new infections. And I'll give you an example of India and Pakistan. If we look on the next slide here, we're going to look at Pakistan and China just to explain that a bit further. So the growth rate can be volatile if done on a daily basis comparison, and therefore it is better represented by comparing on a weekly basis. Pakistan, the growth rate is currently 0.92, so it's below that 1.0, but is not representative of the large increase in daily cases. Yesterday, there were 6,825 new cases on the 15th of June, as we can see in the chart. So if we look at the bottom here, you'll see for Pakistan that there's a steep incline of new cases, but the growth rate is showing that it's coming down, but that doesn't influence the rate of growth. China, on the other hand, you'll see that the growth rate has been pretty much down. It's been below 1, but as mentioned earlier, there's been this spike of possibly second wave in Beijing, where they've got 67 new cases. So that has really upset the long-standing decreasing trend that we've been seeing in China, and is currently at 1.99. What we need to see is what happens in the next few days, if there is a steady increase or it's just a one-off. Now, the testing rates, so we're on the last slide here. This is a new feature. This is the number of tests performed on a daily basis per 1,000 people. I'm looking at 2 countries here. We've got Indonesia, currently has one of the lowest testing rates per day per 1,000 persons. So for every 1,000 people, there are only 0.021 tests performed. However, we have Maldives, has one of the highest testing rates per day per 1,000 people. For every 1,000 people, 1.556 tests are conducted. To give us a better representation, we're looking at this on a 7-day average. So here's some resources. I have put the presentation and the links on the chat. So you've got the link to the Asia Pacific dashboard that is updated daily. If you want to watch and see the figures change in front of your eyes, you can look at the Johns Hopkins University. That is a live dashboard. If you want to cross-check, you can look at the WHO dashboard, the link there. So if you have more questions, we might have time at the end to answer some of those. However, you can contact myself or any of the health team through the Emergency Health AP at ifrc.org. And just want to end here with an acknowledgement to Dedi Junadi. He's the person really behind getting this information up on that board, that dashboard for us. So thank you very much.
Thank you, Nick, for this very detailed presentation on COVID-19 dashboard. And I do hope people can now maximize the information available and can understand much more information and analyze the situation in their respective countries. Now we are going to start our actual technical webinar, and may I invite Pascal and Salome from Global First Aid Reference Center to give a brief overview around COVID-19 and first aid. Over to you, Salome.
Hello, everybody. I hope you can see my screen.
Yes, Salome,
Yes.
We can hear you and also can see the screen. Thank you.
Perfect.
Can you hear me also, Pascal?
Yes, Pascal.
Oh, great, because I had some technical problem and now it's solved. Very great.
Mm-hmm.
Happy to be with you, and thank you very much for this invitation. And we will present Salome and I the adaptation of first aid according the COVID-19 pandemic situation. And it is very important because we we receive at the Global First Aid Reference Center many answer, many questions, and we try to give answer. But it was very a big opportunity to present you the information concerning this adaptation. First, of course, for education, but also for clinical aspect. Next slide, and I let Salome to continue.
Yes, actually, okay, that's fine. Sorry. So yeah, just a few words on the Global First Aid Reference Center. I know that some of you know us very well. I know some names. So just to mention some background. So we are a reference center, like the Climate Center or the Global Disaster Preparedness Reference Center. We are hosted by French Red Cross, and we provide global expertise on first aid with national society and with regional office also. So our work is mainly promote an evidence-based approach and research in order to provide quality first aid education, advocate for first aid with global campaign and events, and support also through evaluation and technical advices, resilience program adapted to countries and context. We had the occasion to work with Myanmar Red Cross or with Thai Red Cross, for example, in Asia Pacific, with Red Cross Society of China also. And we develop many resources and try to make economies of scales with our first aid program. So we have expertise developed or currently developing on first aid and law, first aid and children, first aid for aging population, road safety, trainers of trainers. We made one also in Asia Pacific. So that's what we are doing right now, and also promote harmonization of first aid through the globe. So if you have any more question, or if you don't know us and want to know more, we will share at the end of the presentation some links and service that we can provide even at distance for the national society. So as Pascal mentioned, we were really approached by a national society during this crisis, and now we have to. Sorry, the slide doesn't work. Don't know. Sorry, I have to stop. Yeah. So really sorry, but we don't have Microsoft Teams here, and it's really a problem because it doesn't work properly. So really sorry for this interruption. But yeah, so we had a question and answer presentation regarding first aid, because at the beginning there was many questions from national society, but there was no, there was no, we are not specialized in pandemics and epidemics and health, but at the same time we provide per-hospital care expertise, we provide training and education expertise. So that was a big question on how do we articulate this work around first aid. We make differences between the intervention, like the first aider who are on the ground, and Pascal will develop that in a minute, and also the training with general publics and volunteers. So a big issue we had at the beginning was with the general public was, can I still provide first aid and the idea to rescue someone and to go for someone? And the message that we tried to advocate for was that, like, yes, you can still provide first aid as usual. However, prevention measure has to be followed as much as possible, and people should use water or soap or hydroalcoholic solution to do their first aid technique. And we focused a lot on personal protection equipment and social distancing. That was the idea. We are aware that many of you are in the health department and that you actually know at this stage of the pandemic this measure. It just the idea of the presentation is also to give you some tips to promote that through your country and your population. So that was That was the first question that we had, even from some colleagues who were really wondering what to do in that case. So I still have some now
en bas à droite, en bas à droite, la quatrième petite, tu te mets en position.
No, yeah, it works. So second question was how to do if I don't have clean water, and with the Center for Evidence-Based Practice, which is another reference center, we actually carry out some studies to promote the use of hash if people doesn't have clean water available. So washing hands with hash can be an alternative solution when soap is not available. And the idea is rub your hands with coal ash from a clean wood fire to remove germs, and then take away the ash, checking your hand and using a clean issue. So that was an idea that we try also to promote to National Society who cannot disinfect materials, and also the hands, etc. So yeah, regarding the casualty, I will let the word to Pascal.
Yeah, absolutely. But may I control the screen, because perhaps I can share my screen too?
Yeah, you can.
I try. Sorry again for the. No, finally I count. Sorry,
Yeah,
you can.
Pascal, do you want us to share the screen? Even I don't have the PowerPoint version, but we have the PPT version, because the slides are not moving. So do you want
absolutely.
us to, maybe we can try.
Yeah.
Thank you, Dr. Abhishek, and really sorry. I know it's.
Can you see my slides? Can you see?
Absolutely.
Yes.
Okay.
So, Dr. Abhishek, it's not the last presentation. So Jessie has it. So I don't know if she can maybe share.
Jessie, can you please share the screen, because like the Salome's screen was not moving.
Okay, hang on a bit.
Sorry guys for this, because it is quite important for us to move with the presentation.
Can you see?
Yeah.
Yes,
Thank you.
yes.
Because my internet is also a bit slow, so okay, so you can see it, so it's okay.
Thank you.
Just tell me when I need to move, and then I will move.
Yeah. Next slide, please. Yes, thank you. So that one thing is very important, because of course we have to do the same thing that we are doing during normal time, daily life. But today, during the pandemic, we must be insecure. And first of all, when I have to check to manage a casualty, especially when I have to do the same, the first thing when it's unconscious is of course to see if it's breathing, if he or she breathing. And in fact, it's very important to not to be too close the mouth, because of course you have aerosolization, and you can of course have contact the virus if you are too near the mouth of the casualty. So in this case, you have to observe only the chest, and the abdominal has a regular movement, and not as usually try to see if some hair go out of his mouth. That's very important to avoid infection from the victim, from the casualty to the first aider. That's very important. Next one. In case of course, if the victim is not breathing normally, And if we think that it's, of course, a cardiac arrest, we have to continue immediately the best gesture we have to do. And in this case, again, we have to imbalance the risk of infection and the risk of death of the victim. So for that, be careful again. We are in an environment of the virus, and if we are doing the same thing like in normal life, we can aerolize the virus. For that, first, of course, we call the EMS. Don't change. But after, we have to keep in mind that we have to change our techniques. First of all, if we are in the street, it's a foreigner or in an office, you are not living on the same environment of the guy who is perhaps in cardiac arrest. And in this case, for your security, you have to do just hands only. Hands only because, of course, mouth to mouth is too dangerous. If you are at home, it's not the same. If you are at home or it's an infant, it's not the same, because at home you are living with your own family and you are in the same environment. So the infection will be on the family for sure. And if it is an infant, of course, the cardiac arrest generally came from respiratory distress. So for that, we have to consider the mouth-to-mouth resuscitation. But you are in your own family, and it's very important. We lost the slides.
Sorry about that.
Oh.
Can you see?
Yes, absolutely.
Okay.
But could you to the slide 7, please? Before. Yes, thank you very much. So effectively, if you are at home, so you have to consider mouth-to-mouth resuscitation, because you are within your family. After, of course, you continue as you do usually, and you continue hands only, and you are waiting for the EMS. So that's very important. Next slide. Now we are leaving the lay public. We are going to the advanced first aiders. That's the word. The word is very difficult because in many countries we have different words. Some people are talking about paramedics, if it's professional or volunteers, Red Cross volunteers. But as you see, just take in mind that it's the volunteer of the Red Cross who is in team, perhaps just 2 people, but doesn't matter. And he has to protect him or herself against the virus. For that, we have to use the material we had. Of course, in the slide, you see the perfect material, but we know all around the world that unfortunately we have not all the material. Of course, the most important is the mask and the gloves. That's the most important. After, if we can protect ourselves better, of course, we can use all the protective personal material, and that is quite different from a country to another. But keep in mind that the most important is the mask and the gloves. Next one. For what's the rules for first aid providers in teams? The first one is effectively to begin, but protect ourselves. So to begin to have a mask for ourselves, but also for the victim, if we have enough, to ask to the victim to wear a mask also. And after, in case of cardiac arrest, we have to use the back valve mask. This is very important because, of course, again, we have to avoid direct contact between the casualty and the first aider. Concerning the examination of the casualty, we have to use, of course, the thermometer as the eardrum one or a thermometer, more modern, as infrared, for example, if we have the possibility to use that in our countries. It's very important because, of course, again, to avoid infection, this type of thermometer are better. Concerning oxygen administration, it's very important also for the team to know that oxygen administration facilitates the aerosolization, and we have to place a surgical mask other than the high concentration mask to avoid effectively the aerosolization. And that also important that the expiratory valves is covered. We lost again the slides. Thank you. Next one. Thank you very much. It's very important also to plan the hygiene, and it's very important to use disinfection for all the material before and after each intervention. That's very important because, of course, we have to check that all surfaces are dry and let air into the vehicles or in the health unit if you are outside vehicles. We have to ensure adequate stocks of equipment for all our volunteers, because it is the most important is to prevent disease to our volunteers. We are first responsible to protect all our volunteers against the virus. It's very important also after to put the disposal sheets on the stretcher, prepare a large medical bag in the vehicle and close the vehicle health unit very quickly after intervention. The personal safety is, we have to underline that. For us, it's very important because if the Red Cross and the Red Crescent want to continue its action in our own country, it's essential to protect our volunteers against this infection. And of course, we can do as we are doing normally. We have to adapt ourselves from this pandemic situation. Next one. Next one is of course it's the importance of to consider very quickly the possibility to have this COVID infection. And first of all, we have to not check dirty laundry, because again the virus could be aerolized, and if we are not checking dirty laundry, it may minimize the possibility of dispersing the virus in the air. It's very clear that if clothing can't be immediately laundered, it's necessary just to put them and to store them in a sealed disposable bag, and after we have to wash the items using the warmest appropriate water setting, and as the recommendation is 60 degrees during at least 30 minutes. So if we can, of course, we can of course do that at 40 degrees for 0, and but it's better to be at 60 degrees and during at least 30 minutes. Next one, psychological support. I let Salome.
So regarding psychological first aid, we all know that emergencies are very stressful, and specific stressor particular to the COVID-19 outbreak affect all the population and also the responder. And we really wanted in this presentation to highlight that, to enable the first aider and the rescuer to have potential support and to have access to psychological support. Our colleague from the Reference Center for Psychosocial Support can help in that regard. There was a lot of guidance published in that regard, and it can also be highlighted in your first aid courses to the public or volunteers. for them to have specific training in that regard related to pandemic. And we really consider that as first aid also. And it's also in our international first aid guideline that we have some guidance on that. So the population, but also the first aider needs psychological first aid support. So really take that into account. And now we will pass to the next slide, the training. So can I still continue to organize classical first aid training or awareness session? Just for you to know, we are currently writing a guidance on that, and it should be available by the end of the month, because in a lot of countries, the training are starting to start again and to be in place. It really depends on the situation that you have in your context, in your country, and on the national health regulation. Knowing that gathering of people are not recommended in this pandemic time, but nevertheless, you might have your first aid training session maintained by way of online or another methods. So it's recommended to adjust the way of teaching first aid and cardiopulmonary resuscitation as set out in below in the PowerPoint, and we will have more details on that in the guidance. And the idea is to have both technical adjustments in terms of techniques, teaching the techniques, maintaining social distancing, not recommended to have close contact and mouth-to-mouth for recovery position, cardiopulmonary resuscitation, bleeding, and all the technical part of your first aid training. Communication is also important with your students, and adapt your pedagogy is necessary to make them understand that we are learning, but there is some consideration to take into account. And of course, when using mannequins and other training devices, participants and instructors should wash their hands between each use with soap and water or even hydroalcoholic solution. Mannequins and other training devices touched by the students should be cleaned between each student usage. And ideally, one mannequin per participant is required, but we know that this is complicated, so we can consider other teaching methods to learn CPR, like the use of bottle, or even just show the technique. And exceptionally, participants who have not practiced rescue brace can receive their certification. You can also adapt and think about adapting your evaluation method. So next slide, please, Jessie. So really important to consider during the training has a summary is that promote that social distancing when possible, reinforce the sanitary measure and the rules of physical distance during face-to-face training, and also increase the protection of the trainers. And if you can do so, maybe have a trainer assistant or someone else in the room to help you to face that and to set up these rules. And also maybe sometimes consider the number of people you train to fully respect this disinfection and sanitary measure. So we can pass to we can finish with the key points. I think
Next slide, please.
Next slide, please.
And the key points are really the most important things to keep in mind. First of all, the Global First Aid Reference Center give guidance, give advice, but harmonization is not standardization. So first of all, we have always to follow our national regulation, because everywhere we have some advices, scientific advices or medical advices coming from the authorities of our country. So if some details are different between guidance coming from the Global First Aid Reference Center with your national society, your national regulation, it's very clear that you must follow first your national regulation. After, of course, we have to say we have to continue our normal life and normal action, even we are in the pandemic situation. And it's very important for the citizen to continue to receive first aid education and taking into account this environment and taking into account all the social distancing and wearing masks or other things. But it's important to continue that. And first of all, to secure our training, first of all, to clean hands, and of course, before and after each action we are doing in first aid, and of course, when it's possible, personal protective material. If we are doing that in teams, and especially where we are taking into account an infected person, and if we are able to have that, to wear gloves, mask, or eye protection cap and gown. That's the most important, and it's very clear for you to, first of all, to keep in mind your security, because it's our security of Red Cross and Red Crescent. Thank you very much.
Thank you. Just next slide quickly, please, Jessie, regarding the online resources. We didn't develop the fact that also you can still continue to reflect and to organize blended learning session, because there will be a presentation by Barbara just in some minutes. But please consider all the app and online material which exists in first aid to continue to raise awareness and promote first aid activity. So regarding Global First Aid Reference Center, we produced a frequently asked question document that we were inspired by to do this presentation. We will have this technical and instructional guidance available end of June for your first aid training. And also a toolkit was produced regarding this pandemic, more focused on children and lockdown situation, but it's also available in GFARC's channels. You will have the presentation, I assume, by the end of the day. And last but not least, to try to raise this online methodology, the IE4C with Global First Aid Reference Center developed an online courses on the IE4C platform, and I really recommend you to have a look if you consider to have some online session. So it's free, it's available, and you will also have a link in the presentation through it regarding first aid and children, for example. So the idea is to enjoy your time at home to make that, and also to raise that idea within your national society to consider having more blended learning. So next slide, please, Jessie. Just to finish, as it was mentioned by Dr. Abhishek, we use the same platform. So the help desk, you can find all the documentation with first aid in maintaining national site C services. There is also some documents in Go platform and community engagement help. So thank you very much. I know there is some question that you have raised in the chat, and I think we can answer it by the end of the presentation. But thank you very much.
Thank you, Salome and Pascal, for this informative presentation around COVID-19 and first aid, and also introducing several tools that are available for the National Society to use. Now, may I request Barbara from Hong Kong Red Cross branch to give the experience of Hong Kong around the blended learning. Over to you, Barbara.
Thank you so much. So can everybody hear me?
Yes, loud and clear.
Thank you. And then I would like to have my presentation to share. So 1 minute. So can everybody see my presentation right now?
Yes.
Great. So hi, everybody. This is Barbara Tai from Hong Kong Red Cross, the branch of Red Cross Society of China. So it's my great pleasure to share with you our experience in the development of the blended learning on first aid. So since 2014, our training team worked very hard to promote first aid training in our community. We searched different ideas to create a more innovative learning in first aid. Then we worked with the IFRC Global Disaster Preparedness Center and developed a first aid mobile application in our own language. We also turned our first aid manual into electronic copy so that the people can download on their smartphone or tablet. With these tools, people can attain the first aid knowledge at any time and anywhere they wish. And then Hong Kong Red Cross learned something different from the Asia Pacific First Aid Conference in 2015. From the presentation given by the British Red Cross, we realized that there are something crucial which we should consider when delivering training to the people. First of all, you need to go at the pace of the learner, use language they understand, be alert to whether they are able to process the information and move on, or do you need to find a new way to explain it? Does the timing of the course fit the needs of the learner? So that means a good education should be flexible, and the educator needs to be flexible to the needs of the learner. And from the presentation of other national societies, we believe that the integration of different learning modalities could be an option. So we started to think about e-learning platform together with the face-to-face training. This kind of blended learning can help the students to finish their online learning at their own pace, but can still learn and practice the skills under coaching. Before we propose the idea to our management, we need to assess the learner's need and see if they would take it. Around 60% of the interviewee we interviewed in our 2015 study, they reported that they did not receive any first aid training before. And 1/3 of these people showed their interest in learning first aid. However, 1/3 of them did not know where they can learn first aid, or they thought the training centers were too far away for them. The result implied that there could be a need in remote first aid training, and there was a gap in existing first aid training market. Then our team started brainstorming on the development of the blended learning. To start with, we have several considerations that include financial support, human resources, and also technical support. So we wrote a proposal to our governance to seek their support, especially the financial one. Then we organized different task force groups to share the ideas and collect advices from different stakeholders, such as experts or professionals, staff, and trainers. And we also developed an implementation plan on the subject. With the support of the professionals and technical experts, we incorporate a variety of visual aids or activities in our e-learning course content. For example, we have games, we have illustrations, animations, photos, and videos. We also send the course content to different local authorizations to attain their accreditation. Okay, so this is our e-learning platform. A student should sign up and log in his or her account and start their learning by choosing a chapter. And this is one of the illustrations in our content. And this is one of the GIF images we used. We also have photos and videos to showcase the first aid procedures. In some chapters, we also use games to help the students to understand and remember the theories. And at the end of each chapter, we have short quizzes so the student can have a self-test on their own learning. For example, like this one. So the answer is forward. Okay. And then when the course material was ready, we had a discussion with the trainer of trainers to come up a plan to train our trainers on the concept of blended learning and how it can be implemented. A train the trainer session was then conducted to all the trainers of the first aid training team. So this is one of them happened on January 2018. When everything is set and ready, then the e-learning platform together with the blended learning courses were announced to the public on 13th of January 2018. We conduct a trial course on January 2018, and 16 people out of 19 enrollments participated. So from the result of the trial course, we found out that the average time for online learning was only 6.5 hours, which is almost half of the time required for the face-to-face training. In our face-to-face training, the theory part takes almost like 15 hours. And from the exam result, we found that the passing rate of the written exam was 100%. As a training institution, we had worried that the students might not be able to understand the knowledge without face-to-face explanation. But this result actually proved us wrong. The students did perfect in their written exam. And we also collect some feedback from our students. Most of them reflected that the e-learning platform actually was user-friendly, and then the content was interesting, easy to understand, and very practical. So all of them agreed that they will introduce our blended learning course to the others. And we also collect some feedbacks from the trainers. In their point of view, the training would become more effective if the students could complete the online course before attending the face-to-face practical section. The last step after the trial one would be the promotion of our blended learning. So we have advertisement carried by buses, posted on the bus stop, and also we have editorials on different local newspapers to introduce these new training courses. And up to December 2019, we actually conducted 159 blended learning courses. And then around 3,721 students participated. The overall exam passing rate was 79.7%, which is not bad. And since the blended learning received an overwhelming response from the public, especially in commercial center, because they think that the course is flexible in time and space, and most important thing is money saving, because if they arrange their employees to learn by online, actually less resources are required in conducting face-to-face training. So in view of their overwhelming responses, we also developed different blended learning courses, such as AD, CPR to serve different learning needs. So these are the new courses that we developed recently. Okay, so that's all for the introduction. And I can also show you guys the actual platform that we have. But the point is, I have to share the playgroup English. Okay, so this is, can you all see that? So this is our e-learning platform. Okay, so after we logged in, actually you can choose the course you want to study. Okay. These are all the courses available right now. And then once you click it in, for example, like this one. Sorry, it's just is a little bit slow. It's still running. Okay, so you can see this is actually the learning platform. And then we can go back to the home page, and then you can choose the topic. These are the topics that maybe you would like to learn, so that you just click in and then you can learn. Of course, this is the Chinese version, but we have the English version too. So these are all my sharing. And any questions from the side?
Okay. Thank you, Barbara, for your presentation around the e-learning. It looks quite impressive what Hong Kong managed to did with their e-learning course, and it was very impressive to see the very less dropout rate of people participating in online learning and then coming back to what we call to the skill part as well. So I know like we have slightly overshoot the time, but maybe we can have a couple of questions that is already there in the chat room. One question is, I think, is directed towards Pascal and Salome, which is around like the possibility that like we had discussed around the if there is a family member who can we can give mouth-to-mouth breathing in case CPR. The question is, there is a possibility that the family members are working and going out. So is it still advisable to give mouth-to-mouth breathing, or there might even be asymptomatic case? So is it advisable to give mouth-to-mouth breathing in that scenario as well for the because CPR is termed as one of the most riskiest procedure and aerosol generating one as well. So what is the advice of Global First Aid Reference Center around that? Shouldn't we do in the COVID scenario only the chest compression? Over to you, Salome and Pascal.
A very good question. Effectively, in fact, when I talk about that, it's because we are effectively living on the same environment, and when one member is infected, it probably other are also infected, and also the problem is to consider. It's up to the first aider to do what he think is the best. The guidelines say. Do mouth-to-mouth resuscitation and CPR and cardiothoracic pressure if you are aware on that, or you are confident on that. So, of course, I think after is a very personal problem. If your infant or if somebody of your family is in cardiac arrest, what you will do. We think that because it's your family, you will take the risk. After it will be you will be considered, of course, as perhaps infected, and you will be. It will be necessary to check your health during the 14 days after. But in the family environment, it's really necessary to take into account that it's a people who is very around you. Is it is the person you are very very near, and you love her or him, and of course the risk is imbalance. Of course the necessity to save the life. So it's again, it's harmonization, not standardization, and the word is effectively consider, and after is by your own decision if you are doing mouth to mouth or not doing mouth to mouth. It's just hands only.
Thank you, Pascal, for this. And I think there was another question around the oxygen therapy, and I think Salome have given a very long answer to that. Apart from those two questions, do we have any other question from other colleagues around the blended learning or around the COVID safe first aid practice?
Hello.
Yes.
Abhishek. Yes, I'm Dewindra from the SCCST Pacific Office. Thank you for answering this asymptomatic case that probably you have it in your family member. My second question is about this infection to the ambulance or the vehicles. I know Ebola have one. So do you have standard disinfection for the vehicles that are ready online? Maybe you have it, but I haven't accessed it. Thank you.
Yeah, for the, okay, Pascal, go on.
No, go on, please.
Yeah, like for the ambulances and other thing, WHO did have produced a guideline around disinfection around the ambulance, etc. We have that content in the help desk as well. And if you cannot find that, I can also send. Regarding the IFRC vehicles or the vehicles used by the National Society, IFRC has also developed a guideline around the particular type of SOP, especially in countries with high community level transmission and high cases. In those countries, we have also put some protocol around that, and that has been shared with the fleet of officer of all the country offices as such, and then from our country office CCST to the national societies. So, but both the guidelines are available, be the ambulance, and some of the national societies like Philippines Red Cross and other national societies have also developed their own guideline based on those regarding the ambulances who are really running the big fleets of ambulances. So those guidelines are easily available. If there is any need, you can contact us and we can very well share those to you. Apart from there is one more question from Dr. Rudres. Is like he is asking about like training on site or in person, like by when those guidelines that you have just discussed would be ready, and how the National Society can have that, and what can the National Society do to adopt it to do some training on site. Over to you, Pascal and Salome. Hello.
Yes, hello. So yeah, it is true that the guidance is currently writing, and it will be available by the end of June in the four languages. But the three key points that we will raise in will be to promote or set up distance training when possible, and reinforce the sanitary measures and the rules of physical distance during the face-to-face training. So it means that this can actually lengthen your first aid training. So you have to consider that. You have also to consider how you will evaluate your student, because the techniques might be changed because that we cannot practice actually. But on the question if we can organize training or not, it's really just first thing is to see what are the rules in your country, in your state regarding that. So you can find the information in your respective ministry of health or education. But the idea, if you have on the spot or face-to-face training, is to try as much as possible to maintain this social distancing and to wear mask if possible, and to respect the wash of hands, and to be clearly communicated about that. Your trainer have to have some communication and emphasis on that. And it's also part of your first aid training, because wash the hand, it's one of the prevention measure, as it has always been. And also for that, to get some help, you can consider to increase the number of trainers and increase, of course, the protection of the trainers. Also, we recommend that people having some symptoms of COVID-19 do not participate to the training, trainers or even trainees, and it can be also an opportunity to try to plan some activities online or blended learning, as it was presented by Barbara. That's why we made emphasis on that. The idea was to see how we can enjoy all the tools we have in the iFirst platform, or even in the First Adapt, to try to make this part of your first aid training. So that was some answers regarding that, but complete guidance will be available by the end of June. We are working on that.
Thank you, Salome. And one of the reasons why, as Salome was saying, around the blended learning, we presented what this is. COVID-19 has really pushed us to find some innovative ideas how we can really change our COVID first aid courses. Can it be many national society have huge commercial first aid markets, etc., etc. And one of the major sources of financial sustainability, and investing on digitalization of your first aid course, going around the blended learning. And we have good experience with Hong Kong. Global First Aid Reference Center is also working around something. So if the National Society is interested in doing some digitalization of their coursework, can come to us, and then we can link it you to the appropriate agency, Global First Aid Reference Center, and we can together work together to slightly digitalize the course, because it can significantly reduce the face-to-face interaction between the participant and the trainers, and only during the skill part and some other test, that is where we need to come together. Rest other things can be also done by the e-learning method. And if this becomes successful as it did in Hong Kong, it can also sustain for a long time, and you can have much bigger participant with this with lesser effort in days to come. So this is something worth to think around the blended learning around first aid, provided it is accredited by your ministries and also the National Society is willing to go through. We are stand ready to support you and link you around that during this COVID-19. So I can take one last more question before we wrap up this call. Is there any burning question around the COVID-19 and first aid? Anything around that? Okay, I feel the silence says that there is no more questions. So,
and just Dr. Abhishek, regarding the first aid syllabus, is the back valve mask techniques maintenance currently in the first aid syllabus? Is something that we could not consider, but for the moment it is not included. That was a question from a participant.
Thank you, Salome. So now may I request John to just give a closing remark and some key messages, and next week webinar announcement on testing. Thank you. Over to you, John.
Thank you, Abhishek. I think you've done a very good job of summing up the entire presentations, and the emphasis on digitalization is important, because the Federation, indeed the movement last year at the international conference, has placed an emphasis on digitalization. This was even before the pandemic, so it's a nice fit, first aid and the blended learning digitalization. So I think you've summed it up well. I think it's just for me really to do the thank yous to everybody who participated. We had 60 participants. These Tuesday technical webinars continue to be extremely popular. This was number 10, and consistently we've had on average 50, 60 people at these trainings. So it's or these webinars. So it's an indication of the level of interest. We're reaching a lot of people, a lot of lively debate during the webinars. So specifically before closing out, I'd obviously like to thank our presenters, Salome and Pascal, all the way from Paris. We have a very close relationship with the Global First Aid Reference Center. We meet frequently and we continue to have a strong relationship that we continue to build on. I'd like obviously to thank Barbara very much, an extremely interesting presentation from Hong Kong. I think it's the Hong Kong branch of the Red Cross Society of China. It's fantastic hearing the innovations coming from you. And thanks Abhishek and Nick for the regional overview. I think the technology that we have now, the data that we have, is really interesting. The fact that in real time we can work out the testing, the cases, the growth in different countries, the case fatality rates and such like. So it's really important that we all know where to access this data. So thank you for that. And finally, of course, as usual, Jesse, for all the work behind the scenes. Thank you for that. Abhishek, one more time, please. Number 11 next week. What's the topic again?
It's on testing. Like now the testing become one of the hottest debates. So we will have like which type of many national societies are going around testing for COVID-19. So what is the best test and what are the minimum criteria the national society should think if they are going around testing. And also we'll have an experience sharing from Philippines, from their molecular lab, how the Philippines Red Cross has been doing a very good job and contribute to 32% of the national testing in the country. So yeah, so we will see that experience sharing, and I would hope that would be a very interesting webinar around that as well.
Thank you, Abhishek. So look forward to seeing you all again next week. Thanks again to the presenters, Salome, Pascal, Barbara, and we'll see you all again next week. All the very best. Have a nice day and evening. Goodbye.
Thank you. Thank you very much.
Bye.
Thank you, everyone.